Hi there, Dr. Rauch. Thank you so much for joining us today. So we have you with us here today to talk about the OIF Scientific Meeting that actually just happened the other week in Chicago. So this is a event that the OIF hosts every year, and we gather together researchers from across the country as well as from around the globe to talk about updates of the work they're doing in researching Osteogenesis Imperfecta. And this is a meeting that we wanted to get a kind of overview of for people listening into this call, that they could understand kind of some of the work we do. For those who are watching this video, with us here today, we have Dr. Frank Rauch. He is a member of the OI Foundation's Medical Advisory Council. He is also deeply involved in both research and seeing patients at the Montreal Shriners Hospital. And we are very lucky to have him with us here today. Dr. Rauch, thank you.
Yeah, thanks for having me, Michael.
Of course. So I wanted to basically ask you a few different questions about what the OIF Science Meeting is about and its purpose, and then kind of go into some of the details of the meeting that happened this year. So first of all, big question is, what is the OIF Science Meeting, and can you give us a brief overview of what type of people are attending it?
Yeah, so the meeting, as you said, is happening every year, and it's by invitation of researchers who are, interested and active in the field of OI. And I think it is a very important meeting because it brings together people that work on the same field, and so the exchange of ideas and discussions is very important for bringing the field forward. And I think many of the advances of the past 20-something years that these meetings have been taking place started at one of these OIF scientific meetings. So I think this is really a model for many other diseases where such things do not happen so regularly as in OI. But I think they can copy that from this OIF scientific meetings, because really it's what brings the field forward. So the way it works is usually, I think, 70, 80 people that are invited. And then there is overall, over 1.5 days, 25 presentations. So people show their latest results, and then there is time for discussion among the people who do similar things or have similar experiences. So that's a very effective format, I find, to really flesh things out.
Gotcha. Can you tell us a little bit? So this meeting is happening every year. Obviously, new things are getting brought up, with each meeting. But are there some topics or large themes that are getting brought up again and again, or historically over time?
Yeah, of course. I mean, it's dependent on, of course, what are the problems in OI that people face, and of course, bones and fractures are, of course, a topic that is there all the times. Depending on who is organizing the meeting, it depends a bit what is the focus, and sometimes it's more orthopedic issues that are more discussed. Sometimes it's more basic science issues that are discussed.
Gotcha.
Over the past few years, we have had, in addition, many presentations on things other than bones. So the broader problems that are associated with OI have been more widely discussed. And I think these meetings also set the agenda for what is discussed elsewhere outside of these meetings, because I think all the opinion leaders are there. And that then also is discussed elsewhere when people talk about OI. So I think this is really a trendsetter, if you like, to determine really what people are interested in the field of OI research.
Gotcha. Thank you so much. So you brought up a couple of things that I want to ask you follow-up questions on. One
Yeah.
was about, so I think, you know, we are very happy to hear and see that more and more researchers are interested in the interdisciplinary or multidisciplinary aspects of treating patients with OI. And I think that's pretty uh, easy to understand in terms of like, oh, OI is more than just impacting people's bones and joints. It is impacting many, many organ systems. Uh, you brought up the need for discussing and covering basic research versus clinical research. Can you just explain what that difference is?
Yeah, so the easy thing to explain is clinical research, because I think most people with OI have come into direct contact with that, because they have participated in research, in clinical research, and that's basically collecting information about people with a condition, or people that are in a hospital or wherever you study them. So the clinical research is whenever research includes people. The basic research, you can say, is any research does not include people. So often that is, just purely on molecules or on cells. But in many cases, it's about animal models of a condition. So what we have as models that are similar in appearance to OI in humans is mouse models. So a lot of the basic science in OI is dealing with mice. Mice that have bone problems, that have similar genetic setup as is seen in people with OI.
Gotcha. Can I ask why why mice specifically?
Yeah, that's a good question. I'm a clinician myself, so I had the same question. Why is everyone talking about mice and not something else? But the fact is, of course, practical from one aspect, because mice are small, they breed very quickly. So if you want results fast, it's an advantage to have mice, because 8 weeks after they are born, they can already reproduce. So you can grow them very quickly. And also the other practical aspect is that in mice, you can introduce genetic changes very easily. And that's much more difficult in other types of animals.
Yeah.
And so that means people have been able to introduce variants that they have seen in people with OI, and they made the same variants in the mice. And they were able to see then what is the effect of these variants in the mouse model. And so in that way, we have five, six different mice that have some kind of OI variant in their genes, and are reflecting to some extent, at least, the problems that we see in people with OI.
Okay.
So that's a useful step to have these models, because you want to first test any new treatments or new ideas on a mouse model before you even consider using the same approach in people.
Got it. Yeah, it's sort of it's like determining that almost safety or viability aspect, it sounds like, of
Yeah, one
if
thing
it's
is safety, but also, does it even work? Is
Mhm.
the idea is the idea useful? I mean, if something has no effect in mice, probably it will not be developed further. Um, and the other thing, as you say, is the safety. If the mice have side effects, you will not want to use that in people. So
Mhm.
it's a filtering step of developing new approaches for treatment.
Gotcha. So you had mentioned that this meeting is, a place where thought leaders are getting together with and discussing new trends, new updates together. Uh, what role the OIF playing in this meeting? Because the OIF itself is a patient advocacy group. What are they doing here?
Well, the OIF is a key player in this field, of course, because well, for this meeting, it's organized by the OIF, so all the logistics is done by OIF. And I think OIF is also great for providing a friendly environment that is like not on anyone's particular field. So it's like a neutral ground. It's not like one researcher invites everyone else. It's, everyone is coming to the OIF. So I think that is a very nice basic setup. And of course, somebody has to organize it, and it's not a trivial task to invite, so many people and deal with all the logistical issues around it. And so OIF does it very nicely because, of course, they have a lot of experience with organizing events.
Great,
So
thank you.
everyone likes to come to these meetings because it's a great environment.
Well, we love to hear that. Thank you. So I want to ask, I want to ask one question around why isn't this meeting recorded or more publicly available in the way that, so the OIF prides itself on trying to publish or amplify the work that researchers are doing with OI. So if people are on our email listservs, you may have received updates about various studies going on. If you're on the contact registry, you might also receive those emails. With this meeting, we don't invite the public. Can you talk a little bit about why something like this would not be publicly available?
Yeah, I think if you want a meeting where really the latest ideas are discussed, you don't want to have everything public because the ideas may change next year, and then you have it recorded, and it will be on YouTube forever. So it's difficult to change ideas if everything is already documented. The other thing, of course, is that you have no control where these ideas go that you mention in a meeting like this, and people may scoop you if they, just take up the same idea and run with it. Whereas if you keep it in the room where the meeting takes place, you trust the people that are there, and you can really talk more freely about the latest things. I think in recorded meetings, typically people talk about the things that are already public. So, but the things that we talk about in these OIF scientific meetings, they will be public in 2 or 3 years from now. So it gives us a head start when you take part in these discussions. So I think if you have a really scientific exchange of ideas, it cannot be public because it's just too difficult, and nobody will want to talk openly.
Okay, thank you. So I want to talk a little bit about this year's scientific meeting that just happened. So can you tell us a little bit about who hosted this year, and what were some of the large themes or takeaways from 2023?
Yeah, so this year the organizer or the scientific organizer was Dr. Kozlov from Michigan. And I think every year the OIF invites somebody else to make the program. So that also is a good approach to keep ideas moving and have people with different ideas organize the meeting. And he did a very nice job in finding topics that have been discussed maybe less in the past. So I think one topic that was a whole session was about metabolism, so energy metabolism in OI. I mean, there's many studies that point towards some problems with energy metabolism, which includes things, like heat production in the body, but also insulin, secretion, glucose metabolism. So there's many things that are related to this topic, and there's some studies on individual topics, but I've never seen a whole session on this where basically all the people who work on this were together in one session. So I think that was very interesting. Um, yeah, I think we will hear more about that, and it may also, become obvious that maybe in people with OI, this is a topic that has not really been addressed much in our clinical practice. So that's still in the discovery phase. What are the issues? Then the next step will be what can be done about it, and then at some point somebody will come up with treatments. But this is still in the early phase. So the next thing is a topic that I found also very interesting for a long time already, which is the growth in OI, which is a bit of a mystery until now. Why many people with OI have short stature, why do kids with severe OI at least not grow well? And again, there were presentations that shed some light on this question for the first time for me. So that was also very interesting. We also heard about some new mouse models of OI. So people found or developed new mouse models to better reflect the issues that we see in people with OI. So that was like the program of the first day. And then on the second day, it was the clinical projects that are going on. So an overview of the important clinical projects that are currently ongoing. Like the Brittle Bone Disease Consortium is one big study across North America. There was an initiative about adults with OI, a scientific initiative of researchers in North America and Europe. And finally, there was like presentations of the different companies that develop medications in OI. And this, I think, was also like a new part of the program because there is enough companies now that are interested in OI to have a whole session on this. So this is also quite an encouraging development that so many companies also have an interest in this area.
Yeah, that is very exciting to hear that there's more industry interest and participation in this field of OI research. On that note, actually, could you, looking ahead now to, future years and thinking about, also the big trends today, are there topics that you are most interested or excited about? I know you kind of talked about things that were covered this year, but for future science meetings, are there topics that you are most interested to learn more about?
Yeah, I mean, of course, research is unpredictable. I mean, really good research should surprise everyone. And so I hope to be pleasantly surprised in future also. But the things that I'm interested in is usually the topics that where I don't know much about or where nobody knows much about. And so I think this growth issue that was just started to be discussed this time, I think this has big potential of becoming more important because slow growth is such an obvious and important part of OI that first of all we have to figure out why that happens precisely, and then develop treatments about that. And in other fields of bone diseases like achondroplasia, where there is only short stature and slow growth, there is new treatments that are being developed. So an obvious idea for the future would be to, once these achondroplasia things have been shown to be effective, to apply similar treatments in OI. So that is something that we are going to see, I think, but that will take several years, of course, before we will have any information about these approaches. Another thing that is so far not discussed much is, I think, the gastrointestinal issues. We had also some discussions on that, and we had some presentations on mouse models on gastrointestinal issues. I just hear that often from patients, constipation is very frequent, but really nobody has studied that in any detail, and nobody knows exactly where it's coming from. So I think people are starting to get interested in this aspect, and then we will look at it from the different angles, so clinical and basic science angles. So, and of course, I mean, there's more and more medical approaches for treating OI. So there is certainly new drugs that will be developed and tested in the next coming years. So I think these are all new topics that we are going to see in these meetings.
Great. Dr. Rauch, thank you so much for giving us this overview of the OIF Science Meeting. As always, we really appreciate hearing your insights. And do you have any other final words about the science meeting in particular?
Well, I mean, I hope that you will still invite me next year.
Absolutely, and, don't worry. Okay.
Yeah, I think really I'm always amazed about the quality of these meetings, in a relatively small field like OI. It's amazing that so many top researchers are involved and push things ahead. So I think the OI field is really a model for many of these other conditions that are out there in the rare bone disease area. So they can really copy a lot from your book there.
Great. Thank you so much.
Good. Thank you very much.